And I want to give a really brief introduction to today's speaker, Dr. Dennis Sholler. Dennis and I met about a year ago. We were just reminiscing about the first time I reached out to him for some MSL advice, as I saw he just landed his first role coming out of an academia transition, and I was in a really similar position at the time. So he and I had a few great quality conversations, and he was just a wealth of advice and support. So I figured it'd be great to invite him on and share his wisdom with you all, who I'm guessing are coming out of academia or will be at some point in the future or already have, and are looking to learn more about the transition into the MSL role. So I will pass it off to Dennis, and thanks for being here.
Yeah, Renee, thanks so much, and Lindsay for setting this up. It's so weird to be on this side of the conversation now, where for a good 3 or 4 years, I was the one, listening to a current MSL or reaching out on LinkedIn. I mean, even you and I were right behind each other when it came to coming into an MSL role. So for our audience, this is new for me. I'm really excited to finally be giving back and be on this side of the conversation. But just to tell you a little bit about myself, my name is Dennis. I, like many on this call, come from a PhD background. So I did my graduate work at University of Texas Medical Branch. So I have a PhD in pharmacology and toxicology, and it's as preclinical as you can get, right? It's like all the research backgrounds that we have too. So mine was, behavioral pharmacology, in the context of substance use disorders. So mostly rodent models, but definitely, broke a couple dishes and things like that doing cell work, not my forte. But then eventually, as we'll talk about in today's webinar, I was doing the preclinical bit, but got really excited about doing research with humans as well, and really doing some more of that patient-facing work that we know is so important, so relevant. So I ultimately transitioned to a postdoc where I was at Johns Hopkins Medicine, did my postdoc at the Behavioral Pharmacology Research Unit. So that's in the Department of Psychiatry and Behavioral Sciences. And there I studied the wonderful world of cannabis and cannabinoids, human laboratory studies with research volunteers, randomized control trials, web-based surveys, the whole bit. And I was only there for about a year. We'll talk about some of that in my own story. And then for about a year now, I've been a medical science liaison, and I'm in the area of CNS and psychiatry. It's been a really great transition for something that was brewing for 3 or 4 years. Really reflecting on this past year, really happy that I made the jump from academia to industry. There are challenges throughout that I hope to speak to. And I think that's really what we're going to go into when we kind of transition through these 3 stages that we set up: the PhD to postdoc, the postdoc to the MSL, and then, well, what the heck do you do when you finally become an MSL? So I think I'll flip it back over to Renee and Lindsay. I know we're kind of going to go in a Q&A format for today. So let's go ahead and get started, I guess.
Yeah, let's do it. So as you mentioned, the first stage that we'll go through is PhD to postdoc. And so the very first and obvious question to start us off is, when did you start thinking about the MSL career?
Yeah, of course. So I was kind of doing some prep for this, and the best place that I took to is my own LinkedIn. What have I been doing for the past X amount of years? And so I became an MSL in January of 2021. And I looked back, I sent my first message to an MSL on LinkedIn in September of 2017, which is so long ago now. So September 2017 is really when I started reaching out to MSLs on LinkedIn. And so, it's not as if I was actively applying for the role at any point in time, but that's really where I started to learn about it. So I mean, the first place I really learned about it was just internet search. When you're a PhD, a graduate student, you hear about these quote unquote alternative careers, which I always thought was interesting because they call them alternative careers, but the plurality of PhDs will go into non-academic careers, majority actually. And so it's always interesting that they call them the alternative, but I'm not going to get on that soapbox today. Get on that soapbox next time we do this. Anyway, though, I heard about it as this other career. And so what I did is Google search medical science liaison. You get all these articles that pop up from cheeky scientists and from the MSL Society, and you start to get a little bit of the flavor, right, of what an MSL actually does. But it's really that reaching out to folks on LinkedIn, where we all met each other, where me and Renee met for the first time, when you really get to learn, peek, kind of behind the curtain, what an MSL does. And so we'll talk a little bit about that today. But I think the important point here, especially for PhDs who have that primarily preclinical or bench science experience, is that it takes a good amount of forethought to becoming an MSL. I mentioned that kind of 2017 to 2021. And while it wasn't always in my plans to be an MSL that entire time, in fact, not really until the last 6 months of that time, we have to be strategic with how we position ourselves and our experiences and how we truly make ourselves marketable. So I think I'll leave that question there for now, because it's really what we're going to talk about, throughout the webinar. So that's really when I started thinking about it, somewhere in the ballpark of 2017 or so.
Yeah, that sounds great. I think it's interesting that you mentioned that there was such a long period of time that it was kind of on your radar, but not yet exactly sought after. So a follow-up question, how big of a factor was LinkedIn for you when learning about the MSL role?
Yeah, so I always joke that one day I hope to be like a cover boy for LinkedIn, like I'm going to be a brand ambassador or something, LinkedIn sweatshirts and the whole bit, because LinkedIn changed my life, frankly. To hit on the one thing you said, though, Lindsay, before I even dive into that, it's just, it's so interesting how many people you might reach out to through the process, LinkedIn, learning about the position. I must have talked to maybe 25 to 40 MSLs throughout the time. And some of them won't answer you. You'll reach out and they won't answer you, or they'll say, I'm busy right now. And that's okay. People are very busy and they have other things going on. But if you can, over the course of that time, get a few people on the hook and get some unique experiences, I think it really does pay off. But so how big of a factor was LinkedIn? It was the factor that eventually landed me my position. Like I mentioned, I really took to LinkedIn to learn about the MSL process through what we call informational interviewing, right? That's really the process where you reach out to an MSL, current MSL on LinkedIn. You ask them if you can have a few minutes of their time and really ask them about their role. And so, like I said, I must have done this over the course of 4 years, somewhere in the ballpark of 25 to 40 people in all different forays, some that are current MSLs, some that were MSL directors, some that were in the quote unquote bridge careers that we'll talk about a little bit, some that were currently in medical writing, some that were, in industry postdocs. And so the reason it's important, I think, to not just reach out to these people one time, but to maintain that relationship is that, these are the people like Renee and I, or this group, that's eventually going to become your network of MSLs. I mean, they're the people that are not just going to help you break in, but they're going to be your colleagues really for the rest of your working career. So it's really important to kind of water that, full circle, Renee, with the plans, to really water those relationships. So, when you reach out to somebody, on LinkedIn, because we know it's a big factor, there's a little bit of kind of an etiquette, right, to this informational interviewing. So how are you going to make the best use of your time and also the person on the other side's time, right? So, you might identify MSLs that have similar backgrounds to you. So for me, a PhD guy, preclinical, it might not be the best start to reach out to the person who did an international MD and then came in and transitioned into an MSL. For me, I'm looking for the preclinical PhDs who transitioned to postdocs and then became MSLs, because they're going to give me the best, I guess, case study for how to make that transition, right? So really, I would say number one is really finding those people with the best and the most matched backgrounds. Not to say we can't, and that I didn't talk to people with different backgrounds, but I think when you're looking for a real blueprint for how to break in, you really want to stay tight to your own experiences. And again, thanks to LinkedIn and social media in general, we pour our entire lives out onto the internet. So it's easy to find out what somebody did before they became an MSL. And so don't be afraid to do a little bit of that Facebook or LinkedIn stalking yourself. But what's the second thing? So have questions prepared when you come in to talk to somebody on LinkedIn for that informational interview. You want to be courteous of their time, right? So it's really important when you go into that call, not just to say, so you're an MSL, so what's the deal? What are you trying to learn from that? From that conversation, maybe you want to learn, well, your preclinical PhD, how did you really leverage your research background in your interview and making it applicable to clinical practice, or things like that, and really being courteous of their person's time. And then the third would be, when you have those informational interviews with folks on LinkedIn, ask them if you can follow up, with additional questions or about opportunities at their company in the future. One of the big things I think for preclinical PhDs that helps them to break in, as we all know, is the internal referral process, the process where somebody who's currently an MSL at a company refers you to a position, and that kind of puts you at the top of the pile of applications. So you want to make sure that you are maintaining these relationships as you go on as well. And just kind of to bring this full circle with LinkedIn being the big factor, I think it's because what you do on LinkedIn when you're trying to become an MSL is, in my opinion, exactly what you do as an MSL. If you think about it, you reach out to people that you don't know and you ask them for a little bit of their time so you can gather information from them and try to provide value, to them as well. And so it's really exactly what you do. And when you come, into your panel interview, because I know you all are going to, if you're not already going to become MSLs, you're going to be able to say, hey, I cold called 25 MSLs and got, their time and was able to build a network with them. I'm going to go do that with healthcare providers as well. And it's going to be a little bit different how I do it, but just to show you that I'm not a stranger to this process. It's something that I've been working on. And so I think it's really the essence of being an MSL. So to put a pin in that, how big of a factor was LinkedIn for you? Well, I'm going to reach out to them one day and ask them if I can be a brand ambassador and hopefully get sweatshirts and a big decal that says LinkedIn on my car and things like that. So I think I'll leave that question right there.
I love that. I also love that you brought up, be courteous of their time and follow the etiquette. Make sure you have questions prepared, because it's going to show the MSL that you care and you care about their time and you're being respectful. So I think that's really important. We're going to transition a little bit, not quite to the postdoc yet, but I know we'll talk about that in a little bit. You mentioned bridge careers and other alternative pathways that you were considering prior to your postdoc, but after the PhD. Can you speak to a few of those, potentially ones that would make you a bit more marketable as a PhD wanting to break into the role?
Absolutely, yeah. And Renee, too, I think the LinkedIn bit really does match, well to being an MSL. And
definitely,
I'm sure you can relate to me on that too. And when it comes to career paths that make PhDs more marketable, I think maybe we start with why do PhDs need to consider bridge careers in the first place? I mean, clinical pharmacists don't need to consider bridge careers, and DNPs don't necessarily need to consider bridge careers. So why preclinical PhDs? Well, I think the tough part is that when you're an MSL, you're really talking to healthcare providers at a peer-to-peer level. And I'll talk about this when I talk about my first days as an MSL, but clinical practice experience is really important to speak a common language with folks. Our research is very important, but it doesn't necessarily translate to what's happening in clinical practice. And frankly, even when we call our research translational, I don't believe it's always translational. We think it's translational because, we could see our research informing phase 1 clinical trials, but, a psychiatrist is not seeing somebody in a phase 1 clinical trial. They're seeing a patient with depression who needs help today, so I think the point of the bridge careers is to probably give PhDs with preclinical experiences a little bit more exposure to that clinical practice side. I think that's where it really comes in. And I didn't have that at all, and so that's what I was really looking for. And for me too, I should say that, where I ultimately ended up was in a postdoc. And the number one thing for me transitioning into a postdoc was the research. I love research. I would do research forever, if all the conditions were right. So at the time, my transition was really motivated by that love of science. But the second thing to think about really is what career might position you the best to break into an MSL if you're having trouble coming from a preclinical PhD position. What's going to give you a little bit more exposure? Well, I guess, what are we looking for when we transition into an MSL? Well, we're looking for MSL experience. Unfortunately, we don't have that, right? Because you can't get MSL experience until you become an MSL. It's the revolving door that they make us face. The second thing would, I guess, be the D degree. We will have that with a PhD in this case. And then the third would really be some therapeutic area experience or clinical experiences. That's what we're really trying to get. And so that's where the bridge careers can come in handy. And so I'll hit on a couple of them. Some of you probably have these careers and can speak better to them than I can. So I'll just say a few that I learned about. And I actually again, preparing for this, I had a note on my phone from June 2019 where I listed these out. So let's see how I still feel about them. So the first one is medical writing. Medical writing is a popular one. In my informational interviewing, met a lot of MSLs who were medical writers, either currently or in the past, probably about 4 or 5 of them. And so if you're interested in that as a potential career choice, I think the transition could be a little easier for a PhD to go into medical writing than to go directly to something like the MSL role. So definitely reach out. For me, I think it's a really valuable position. I didn't see exactly where you really had the direct add of that clinical experience of interacting with humans and in clinical trial settings, but nonetheless, there's a lot of people that have very successfully made that transition. So feel free to dig into that one if you want to learn more. The second one, clinical trials research, either as a clinical trials coordinator, clinical research coordinator, a clinical trials manager. I think a couple of our registrants were even in this area too. What's one of the best ways to get clinical research experience is to participate in the clinical research process. So that's definitely a good one. Some advice that was given to me is that, remember that you also want to be involved in kind of that conceptualization, right? Coming up with experiments, writing manuscripts, being involved in the grant writing process. Sometimes as a clinical research coordinator, you're delegated to just carrying out the research that's being conducted. So that's the only cautionary tale I might give is to make sure you're in other ways still being involved, in the conceptualization of the research, but nonetheless, a great way to get some experience as well. And another one that I thought of at first, but I don't know has panned out as much is medical affairs specialist or medical affairs supportive roles. So, within a medical affairs department, which houses MSLs, of course, there are other roles like operations and things like that, which could get you some experience in seeing what MSLs do in the day-to-day, maybe developing their content and resources and the like. Now that I'm in my position, I don't see a lot of people in those medical affairs roles that are necessarily interested in transitioning to the MSL itself. But again, I have a small sample, so can't say for sure, but something to look into. Postdocs. I was a postdoc. We'll talk a lot about that. I'll talk first about postdocs in industry. I think could be an incredible example because you're still involved in the research, especially if you get into some research that's human facing, and then you're actually in the industry setting. So a lot of companies do offer postdoc fellowships that are research focused in industry. From my experiences, they're competitive. I didn't actually try to break into one, but I have friends and colleagues that have broken into some of them themselves. So check out some people who are doing postdocs in industry on LinkedIn and ask them about their transition and maybe their career aspirations as well. Finally, what a better bridge career than the academic postdoc, right? Everybody loves to be a postdoc. So I think I'll leave this one here with the bridge careers because we're going to go a lot into this. And it really takes us into our second stage, which is my postdoc and then postdoc to MSL phase of my life. So I'll leave it at that for now.
Yeah, thanks for sharing all those options. I've definitely heard some of those as really good, bridge careers to MSL. All right, and what you just left us on was the postdoc to MSL part of your career. So to start us off, why did you ultimately decide to do a postdoc? And why did it make sense to transition to a postdoc versus a career outside of academia?
Yeah, of course. So disclaimer, I have bias, right? I was an academic postdoc. So I'm going to try to balance this out the best that I can. But why did I ultimately decide to do a postdoc? So there's kind of the science, and then there's also the logistics, right? So I really like research. And the majority of what motivated me to transition from preclinical research to human laboratory research or clinical research really was the science. I liked the potential impacts on patient lives, that it wasn't translational, but it was actually what was being translated. It was a little more human facing. So that was really the big driver. But really, why did I ultimately decide to do a postdoc? That's one. The second is that, in my opinion, for a PhD, when you're at the end of your PhD, things get really chaotic really fast. It's like you're writing your dissertation, you're getting ready to defend your dissertation, you're waiting on revisions from your committee, and all the while you have to find something to do after you're a graduate student too, unless you want to be a graduate student for the rest of your life. It sounds like a never mind. But so you have to think about what's next. And a lot of the times, the logistics of being a late stage graduate student doesn't necessarily, in my opinion, fit in with the job search. I could put in 2 weeks notice in my current position and transition into another position. But what do I do if I defend in 2 weeks, but I don't know what my revisions are going to be for my committee? Well, in academia, your potential postdoc mentor, there's an understanding of what that process is. And I feel like it can be a little bit more accommodating then, right? When you're transitioning from graduate school to your postdoc, we're all kind of on common ground, right? With the logistics. So, you don't have to feel so stressed about that part. For example, I defended my dissertation in November of oh man, when was it? Oh, November 2019, the COVID years, right? It's brutal. November 2019, but I think I interviewed for postdocs in like June or July 2019. So like there's a lot of lead time, before that. So so that's two really is the logistics. So what's the third? Well, we've talked a lot about building a network, this whole idea of building a network of people through LinkedIn or otherwise. If you're a graduate student, think about where your biggest network exists currently. It's probably in the area of your research, right? Through your mentor, your primary mentor or co-mentor, the faculty in your programs. So then how can you leverage your greatest network for your next potential job? Well, the principal investigator that you work with as a PhD student likely has some connections to some of the best researchers in your therapeutic area. And some of them, if you're preclinical, may be human researchers. And so that's really what happened for me. And I'll tell you a story in a little bit about my transition. But if you can leverage those connections in your graduate school network, either your mentor or some other advisors, you may be able to transition into, that postdoc, right? That may be clinically facing or human laboratory research facing. And it'll serve you in a number of ways. Number one, it'll give you that much desired clinically facing experience that you may need or may be lacking as a preclinical PhD. Two, it'll give you that phenomenal experience in actually reading and conducting and writing about clinical trials, which is the heart and soul of what you do really as an MSL. It's really talking through phase 3 clinical trials with healthcare providers and trying to bring the benefits and the risks and balance them. It's really the heart and soul of what you'll do. And then third, like I said, your postdoc mentor understands the timeline of a PhD student trying to defend and come out of school. And so I feel like it can be a little less stressful and logistically can be a little bit easier than trying to go find and time positions in medical writing and things like that. So that's just something that I observed. And this was from my own experiences and conversations with many others that went through it. So I think, for me, kind of reflecting on why did it make sense, I would say the science was where I wanted to be. The logistics made sense, and I could see the clear value in the future, whether I wanted to remain in research or transition to another career, of making that jump from preclinical to human. So I hope that helps for now.
Yeah, I think that's really, really helpful and so wonderfully put. I mean, touching on all of the reasons why it was important to you and to you specifically is also something that I'm sure you spoke about during your interviews, why you made that transition and how you utilized your postdoc to your advantage and how it helped you transition into the MSL role. So I think those are all really great points to make.
Mm-hmm.
And you mentioned, becoming involved in human research after spending so much time in preclinical research. So I guess, could you elaborate a little bit on why you specifically chose to get involved in clinical research for your postdoc, and also how you leveraged your network to be able to make that transition from preclinical to human?
Yeah, definitely. I mean, I'll try to weigh more on the second part of the question than the first, because the first is really personal for me. I did research in the area of substance use disorders. We did a lot of really valuable preclinical research in rodent and animal models, but I'm really motivated by the process of making medicines, medications development. And for me, the place where that really provides immediate return and this might sound selfish, but makes you feel really excited about going to your job every day is to really do that in a human laboratory setting or the clinical trial setting. Now, that's not necessarily what I did in my postdoc for my short amount of time. It was more the understanding of the behavioral pharmacology of substances, whether used or abused, but I really love the direct relevance of that research to public health. And I think that really, to bring it back to the MSL, is what you'll discuss every day, with healthcare providers. You'll talk about a phase 3 clinical trial, but they're not going to be asking you about if they ran two-way ANOVAs. They're going to be asking you about how does this affect my patient today? What do we need to know about the dose relatedness of treatment emergent adverse events? Or why was 1 milligram significant, but not 2 milligrams per day, even though it's high? Those little nuances, what they're really going to be looking for. So that was the one I really wanted to be involved in, that more relevant process. But, how did I leverage my network? I have a story that I'd like to tell on exactly how this all came to be. So defended my dissertation in November 2019. Every June, so June of 2019, every June there's a conference, College on Problems of Drug Dependence. Renee, you may have been to that one. So CPDD, that's okay, someday. So CPDD is a big substance use disorders conference. And so there's a lot of people that are there. It's actually predominantly a clinically research focused conference. And so I knew that it was my best shot to network with potential postdoc mentors. So what I did is I kind of looked at who was going to be at that conference, all the researchers from different universities, and found investigators that I was interested in working with. So there's 3 of them. They were all human focused, all doing human laboratory research or clinical trials. And what I realized is that they all had a connection to my graduate school mentor in some way. So what I did is I actually asked my graduate school mentor if I could reach out to those folks with her CC'd in the email to set up a meeting to discuss their research at that conference and potential postdoc opportunities. And so what I was able to do is actually leverage my network from my graduate school advisor to set up meetings with potential postdoc advisors at this big conference that we all attend. And the nice thing is that from that conference, those 3 people that I met with eventually turned into 3 postdoc interviews. And so that's where I was really able to get my foot in the door with potential postdocs that were important to me. They were all still in the area of substance use disorders. They were all, though, in human laboratory or clinical research. And so for me, it's exactly the transition that I wanted to make. I found a lot of value in doing that. And so what I then did was kind of went through the postdoc interview process, which was a lot more accommodating with my timeline because I was writing my dissertation. I was getting ready to defend. And eventually, somewhere in the area of the fall, I decided and agreed to do a postdoc. It was eventually at Hopkins. And had some flexibility on the start date, but really was able to immediately leverage that network that I had from my graduate school advisor, who I'm forever grateful for the teachings and for that network, and to really spin that into my bridge career, if you will. It wasn't always at the time, but it eventually became my quote unquote bridge career. So that's really how I work to make that transition from preclinical to human research.
Yeah, that sounds great. That's a good story of how, you never really know when somebody will become a crucial part of your job search or career or something like that. It might just start out as a contact somewhere. All right, so now you're in your postdoc. When did you ultimately decide to pursue the MSL career, and how did you get into your current position?
Right. Yeah, it's a great question. And the background to all of this is that during all of this time, I'm still on LinkedIn, right? I don't have the sweatshirts and the car decal yet, but I'm still maintaining the relationships. And so it's a mix of reaching out to new people now that I kind of have this newer experience. And frankly, it was less of that because I was really liking my postdoc. Like I was having a lot of fun doing the research. And it was really keeping up with people that I had met over the course of the years. And again, so important. And Renee, you might speak to this as well, or any of the other MSLs on the line. Making the connection is one thing, but maintaining the connection is just as important. I mean, you want to bring value to people and be human and build relationships. It's really so important. And so I think it goes further than just that first phone call or that first meeting, and really checking in and say, hey, how are you doing? The last time we talked, you said you were thinking about making this transition. Well, did you ever do that? Kind of what happened with that? And really just taking interest in people. And what happened for me is that somebody who I had that relationship with on LinkedIn eventually reached out to me about 6 months into my postdoc or so, maybe 6 or 9 months. And I'll have an add-on story for that too. He reached out to me and he asked me if I was interested in a position that they had open at his company that he would refer me to. And so it's kind of like all of these years of LinkedIn, like the networking, they finally pay off and you finally get that ever so important referral. But frankly, it wasn't because I did a postdoc in X or Y, or it wasn't because I had this, it was because I maintained the relationship. I really feel that way because I took interest in really maintaining the relationship, which is what we do as MSLs. But, this was probably late fall, late summer, early fall of 2020. And I had met him in June of 2019. So we've been keeping up at that point for over a year, just back and forth. And so again, kind of keeping that relationship, and then eventually, somebody comes through for you. And now that we work together, I like to think I can pay him back by maybe doing some grunt work or anything like that. But he ultimately referred me to my position, right? And again, really think it demonstrates the value of really maintaining the relationships. But what's the big problem at this point for me? I wasn't pursuing the career at that time. I had just started my postdoc, but yet this opportunity fell into my lap. What am I going to say to my postdoc advisor? As a lot of you know, sometimes it can be tough to slip out of academic positions and into industry. Sometimes the sentiment isn't so welcoming for that, and we can have that conversation if you'd like. Luckily, my postdoc mentor is amazing. I mean, we're going to be lifelong friends. I mean, I'll tell you the story of what happened. So this person reaches out to me, who's now a friend. He's at the company I work with, reached out about the opportunity, but I'm only like 6, maybe 8 months into my postdoc. So I call my postdoc mentor and I say, hey, you'll never guess what just happened. You tell this story that somebody reached out. And it's true that I wasn't looking for a position at this time. A connection that I had reached out about an opportunity, knowing of my underlying interest. And what I said to my postdoc mentor was, this is an opportunity that I'm really excited about, and that I would really like to pursue, but I'm nervous because I just started my postdoc. Like, how do I reconcile this? I want to keep getting the experience. I'm less than a year in. What do I do? I'll never forget what he said to me because it just meant so much to me. He said, Dennis, it's like you're interested in this job now. And so you have 2 options. You can either take the job now and say, well, I didn't get as much experience in my postdoc, but I have the job that I want. Or you can stay here working with me for 2 years, and then you can be back in the exact same position in 2 years. So why would you wait, if you have this opportunity in front of you now? And it just was important to me because in academia, that's not always the feedback you get about transitioning to industry, which kind of comes back to when making that transition and thinking about that bridge career. Think about who you're working with. Think about your mentors and the people that you have the privilege of working with. I was so lucky to have somebody that is so supportive of me and really cared about my career. But to give, our academic friends the benefit of the doubt, it can be tough to let your mentees go because there's a lot of incentive to have your mentees do well in research and kind of continue on the legacy. So I'm grateful to not have faced that, but that's just a story of how the timing wasn't right. And I don't know if the timing would have ever been right, but because I had a supportive mentor that was there for me in making the transition, it all worked out. So that's kind of how I ultimately decided to pursue it. It was through the internal referral process. And I think, again, kind of speaks to the value of keeping and maintaining that relationship that you have on LinkedIn. So hope that helps for now. January 2021 is when I officially started my MSL career. So I've been in it for just over a year now. So I think we'll probably transition into some of the learnings from that first year.
Yeah, thanks so much for sharing that story. I just can't help myself but to think of how identical, or almost identical it is to my own story, which is part of the reason I found myself reaching out to you and looking through your profile and getting to know your path was one of the reasons that, I felt comfortable reaching out and talking to you. But so many of the things that you said resonate with my transition as well. So I think it's just helpful to hear it from, people over and over again, just to sort of normalize the process, and that, it can happen in many different ways, but at the same time, if you build and establish those relationships and keep them, then your chances of building those lasting connections are definitely higher. But yeah, so many similarities from our 2 paths. It's funny. Right. So now you're in MSL, January 2021. We're going to talk a little bit about that. And I want to highlight somebody's question in the chat is actually quite similar to the next one that we had queued up. So the question from the registrant is, tell us about your training when you first started in your MSL position, and how did your research background help you? And just to connect that with the question in the chat, do you feel your preclinical experience has been valuable as an MSL as well, and how?
Yeah, all kinds of great questions. Thanks for the folks active in the chat. So talk about the training. So I guess before I dig into that, the one thing I did want to mention is when you're a new MSL and you don't have experience, there are some companies out there that are more likely, from my experience and learnings, that are more likely to hire new MSLs. I won't name any of them specifically. One of the tells, I think, and you could feel free to ask this to people you informationally interview with, how likely is your company to hire new MSLs? Are you familiar with companies that are more likely to hire new MSLs? But what I've noticed in just my own experience and talking to others is that the companies that are bringing in new MSLs have top tier training programs. And I'll tell you a little bit about my training when I came in. So my training was an intensive program. I think it was somewhere in the area of 12 weeks. And so our company, I trained on 2 products. So half of that time roughly was on one product, half of the time was on the other product. So 12 weeks long. And it was a mixture really of slide decks that you will use in the field as an MSL, peer-reviewed publications, a lot of those, videos to kind of, so that you don't have to read peer-reviewed publications all the time. So that was nice. Basically, it's all high science. Like, it's all the things that you and I deal with all the time. And when you think about how does your research background help you? Well, up until this point, our friends with the clinical experience, I think, really have the edge. Our PharmDs and our NPs and our nurses and our MDs, I think, because they really have the experience. But I felt like when we went into training, thank goodness, finally somewhere where I feel comfortable reading papers and digesting information. And really, to the question about the preclinical experience, this is really where that happened, right? You can understand research design, you can understand statistical methods, you understand hypothesis testing and things like that. And so that's really what the training was predominantly reading those publications, reviewing those slide decks, synthesizing and retaining that information, and then on a weekly basis also reciting some of that information through what we would call a virtual classroom. And this is essentially a place where we all came together, kind of divided up our quote unquote curriculum for the week, which was a mixture of readings and slide decks and things like that. And we would present them to our training lead as a group. And so this gives you the opportunity to leverage your research background again, right? Which is not just taking in the research, but delivering the research as well. This is somewhere that you finally have the experience over people that haven't done research before but are purely clinical. And so once you get to that point, it was finally somewhere where I was feeling comfortable and confident. When you got out into the field for the first time, it becomes a different story. At least it was for me, because that's the real where the rubber meets the road. But in training, it's really where I felt confident, because really it's 85 to 90% research, right? And so rest assured that once you start training, I think that your research background is really going to kick in and take over. So that is where my own research background helped me, is that it was focused around things that I had been doing for all the years prior. So I hope that helps answer that question for now.
Yeah, definitely. Now that you're feeling confident with your research background and that training period and everything, now can you go into a little bit of what some of the challenges you faced were being new to the MSL role? And that includes, what were your first meetings in the field like?
Yeah, sure. This is where you realize that it's more than just reading and regurgitating research. So I'll come back to this time and time again. Even though I had a little bit of exposure to human laboratory research and the clinical trials process, it's no substitute for the clinical practice experience that our clinically facing friends get, our PharmDs and our nurses and our MDs and things like that. And so sometimes when you go into a meeting with a healthcare provider, and maybe you're in a community mental health clinic, you're not in an auditorium with 25 people listening to you talk on script. There's people asking you very targeted questions about the relevance of the research to something they're doing or considering doing with a patient tomorrow, you know, and you have to deliver that fair, balanced information based on that research. And you don't have 15 minutes or 20 minutes to pontificate on it. You know, it has to be a quick synthesis of pros, cons. This is not a clinical recommendation, but here's what the data tell us. Boom, 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 good, bad, use your clinical judgment type of thing. And it's really a shock to do that. And it became apparent to me why PhDs struggle to break in, because it hurt. Like, it was hard to transition into that. And it wasn't really until probably the end of last year that I finally started to feel a little more comfortable in that setting. And it's really because you start to learn through the conversations what people actually do experience in clinical practice in your area. So kind of by way of being an MSL, you're starting to get that exposure to what's going on in clinical practice. And so it was really a challenge for me to not be in the weeds of the research. I love experimental design and how the nuances of how you designed a clinical trial may inform the outcomes. But today at lunch, that might not be important to a healthcare provider that's seeing a patient at 2. You know, they might want, what is the most representative way to synthesize that data in a fair, balanced manner? And when I say fair, balanced, I mean highlighting both the efficacy and the safety, something you'll hear a lot as you become more entrenched in the MSL world. So my first meetings really were a little bit of a wake-up call. It has to go beyond just the research, right? You know, HCPs, healthcare professionals, they want to know the relevance to their clinical practice now. And so I think for us, preclinical PhDs, I think it's important to be well-versed in the experiences, right, of communicating that real world value of the research, right, potential benefits and risks, and to really challenge yourself on what is that real world value. You know, I'm guilty of translational research, right? When you talk about something translating from preclinical to clinical, you might mean an experiment that you did in, you know, CHO cells translating to what you might do in a phase 1 clinical trial. But that's really not what we're talking about. We're talking about how is it going to benefit somebody who's seeing patients today. And so really just I challenge myself on this regularly, and would challenge everybody on the call to really think about how does the research actually impact clinical practice. And that's about as far as I can go, because I'm still learning. So I'll always be frank with that, remember, this is about first years in MSL, so I have a lot to learn still. So, but that's just kind of my takeaways so far, but always learning, always trying to grow and become better in that way. So those are that's what the first meetings really like, though. A big challenge, but finally getting more comfortable. And Renee, feel free to jump in too if you have any learnings on this side as well. But I'll leave it there for now.
Yeah, I like how you described your first few meetings as a wake-up call, because they certainly were for me too. But I think that circles back to your statement earlier. You know, you can't get experience without getting experience. So you don't know what it's going to be like until you're actually there and having those conversations. And another thing to add is, at least in my experience, every KOL or KME or whatever you call them, are so different. And they all want to talk about different things and focus on different elements of the conversation. So adjusting, you know, based on your background information and all the information at your disposal is one of the most important and kind of difficult things to learn how to do at first too. I don't know if you feel the same way, but
yeah,
just kind of being able to anticipate questions is pretty difficult, and you know, it takes a while.
Yeah, and I can add just to that, because I think you brought up a phenomenal point of you have different, you know, KOLs or whatever you might call them. You have some that may be coming from clinical research. Maybe they're not necessarily seeing patients, but they're doing purely research. All the way down the spectrum of, you have people that are working in like a maybe a private practice or community mental health setting. And for me, I always felt way more at home with the people that are in clinical research, because I feel like I don't want this to come out the way it sounds, but I feel like I can hang a little bit better in the conversation. Like I can lead on my experiences more. Whereas like when we come down to more like community mental health settings, I'm trying to learn. You know, I'm being very frank about that with the providers. Look, you know, I'm your research guy. I'm here to help, but I'm here to learn from you, because, you know, we can do research all day long, but you know, it doesn't progress without your clinical experiences. So that's really why I'm here, to learn from you. And I think being humble about that is important, because you don't want to come off as, you know, that you have it all figured out and you're trying to impose this upon them, you know, because genuinely I'm trying to learn from these folks. So just I'm right there with you, Renee. So.
Yeah, totally agree. I think this is a really great segue into one of our last submitted questions. So how do you exactly leverage your research background to bring value to HCPs? I know we've talked about this a little bit. And then has your research background ever actually helped you get a meeting with an HCP, or have you ever directly used that sort of in your introduction?
Yeah, it's funny you should mention introductions, because you know, the introduction is sometimes the place where I will leverage it, especially with our folks that are conducting research. So, you know, you might reach out to an HCP to request an introduction meeting, one-time introduction meeting, but it's kind of like, why should I meet with you? You know, like, what do you have to bring? We always want to bring value, right? And so one of the things I'll do sometimes in, you know, an introduction is to be familiar with that person's research if they're so doing it. So our clinical research folks, or maybe our MDs who are involved in clinical research, you're finding their latest papers saying, you know, hey, Dr. X, it's great to meet you. Saw you just published X and Y, fascinating stuff. Hey, would you have time for a one-time introduction and just talk briefly for 15 minutes, say hello? And it's like, think about when you reach out to somebody on LinkedIn. If you just say, you know, hey, I'm Dennis, can you tell me about being an MSL, versus, hey, I'm Dennis, I did a preclinical PhD and I saw that you did too. I could really learn from your experiences. Can you help me out? It just adds that level of, it's personalized, it's a little more specific. And I think, you know, being able to relate with their research just by knowing where to find it, right? Google Scholar, clinicaltrials.gov, PubMed, really helps in getting people on the hook. The one thing I've noticed a lot that unfortunately I can't speak to fully in my role as an MSL, I did cannabis research for a short amount of time, which is something that providers in the mental health professions are very interested in, especially as legislation's changing. So when you introduce yourself, you know, don't be shy about telling them what your research was in, because I got to tell you, every week people are asking me about cannabis now. And while I can't really go in too much because it's not, you know, consistent with what my company is doing, it adds some credibility. It adds a little bit of, you know, a rapport with the providers, and they see that it's actually, you know, this research something you're actually involved with. So that's another way it's really helped me. I'll say the last place that it's really helped me is, what value do I bring to a healthcare professional? I jokingly will say that I'm kind of like this research concierge service. You know, I've done research for years. My job is to really look things up and then tell people about them. It's what I do in my day-to-day. You're very busy. You're seeing patients from 8 a.m. to 9 p.m. and maybe taking 2 bites of a turkey sandwich in between. You don't have time to go on Google Scholar and read a paper. So what if instead I could kind of use my expertise in research, synthesize the research that's available, give you a quick idea of the efficacy and safety and tolerability, and just give that to you in a quick conversation so that could provide value to you. I think that's really where your research background comes in, because you're able to, you know, take the research, synthesize it, deliver it, and provide value to somebody who's very busy. And even though they're interested in research, they just simply don't have the time maybe to really dig in. So offering that is something that has helped me in maintaining relationships, especially as new research becomes available. But really, I think the other thing to conclude this is being honest. I mentioned this earlier, being honest about maybe your lack of clinical practice experience and how you have a purely research background and maybe they have a purely clinical background. Think about that superpower if we were to bring the two together. Like, I'm bringing kind of the research input and you're bringing the clinical practice input, and we're creating this scientific monster together. You know, we're learning this together. So that can resonate with some folks as well. But there may be instances where people don't see the value right away in working with their PhD MSL. So I just encourage folks, maybe don't get discouraged by that. Maybe try to understand where the person's coming from with that. But, you know, bringing it back to our relationship building skills, you know, follow up, be considerate of their time, really focus on what you're bringing when you come into that meeting, what that value really is. So has my research background helped me 100%? It's definitely on a sliding scale of who might benefit from it, and being creative about how you market those skills in getting meetings. So I think this brings us to a really nice trajectory of, you know, PhD all the way down to how things been going in my in my first year. So hopefully we'll all get back together in 10 years and I'll give you my 10-year update. So stay tuned for the 2032 Zoom link for that one.
Yeah, that sounds great. We'll be happy to have you back then. We do have one last question that Renee and I like to try to ask our speakers every webinar, and that is just, what is one thing you wish you had known about the MSL career, or I guess one thing you wish you had known or done differently before becoming an MSL?
Yeah, it's a great question. Known or done differently? Let me think about it for a sec, because I want to give a good, I don't want to give a stock answer. So known or could have done differently.
Yeah,
So,
sorry to put you on the spot.
no, it's okay. There's a couple of things I could just go kind of off the cuff, but I'm really trying to give like what truly is. I think when I was doing the LinkedIn bit and reaching out to people, when I first started, maybe it wasn't as focused. Maybe it was kind of more like a blast to anybody that had the title MSL. But where I really started to learn is when I finally started reaching out to people who had my background. And I think it saves everybody time. It allows you to take more out of your conversations, and it allows the person on the other end of the conversation to learn as well. Somebody in the chat asked about how do you bring value to the people that you reach out to when you're learning about the MSL. And I always used to joke with people I talk to all the time. It's like, one day I'll pay you back, but one day you do pay them back. Maybe they get invited to do a webinar like this, but they don't have time. And so they can suggest to you to do it. Or maybe they're looking for a job, 3 years down the road, and they see my company and they're looking for a referral. Well, you helped me break in, of course, so it might not be today, but there's incentive to build a network and to mentor. And so that's always something to kind of push forward. So that's kind of I would say, getting into the career. I'd say, now that I am in the career, it really is, I can't say enough just how important it is to be familiar with clinical practice, because it's really where you spend your time. And it challenged me to really think about what it means to do translational research or to be translational. And there are times where I almost feel guilty when I was a graduate student when I called something translational research, because I may have meant, how does what I did in a rat inform the dosing, in their exploratory study in, at an academic medical center. That's not really what's happening when a patient who is, who's really going through something tough and needs help today. It's not there. So always thinking about and being honest with yourself about what does it really mean to be translational and what does it really mean to bring value as a researcher. I think it can be as simple as helping very busy healthcare professionals understand the research process who may not have as many touch points with it. So I'd say those, hopefully, off the cuff, are two learnings. Hopefully they're unique enough that I didn't reiterate something that anyone else said, but ask me again at the 2032, Zoom meeting.
At the 10-year reunion.
The 10-year reunion. That's
no,
right.
I think it's really important to mention kind of curating your messages the way you did and finding those who you have the most in common with, because you're helping them because you have similar things to talk about, but also you're helping yourself by learning of relatable information and stories that you may not hear from somebody with a completely different background. So I think that's really great advice. We are coming up on the hour, and I don't think we have any other questions in the chat. If anyone has any last minute questions, feel free to throw those in or take yourself off mute. But otherwise, we just want to thank you so much. I think this has been one of our most valuable sessions for people coming from an academic background, not really knowing where to start, and kind of learning more about those transitions and where to find value and add value, and taking your research into consideration and having that help you in your interview process and landing that first role. I think you provided so much great advice. So thanks so much for your time.
Yeah, thank you for the invitation, and for everybody, thank you for taking some time. Feel free to connect on LinkedIn if you're on there. I'm sure you all are. And just one disclaimer, I'll say this for everybody too. If you message me and I don't respond right away, it's not personal, I promise. Things just get busy, but know I'm thinking about you regardless. And I see you when you reach out. So I just want you to know that. But But thank you so much for the opportunity, Renee, Lindsay. It's been awesome. So happy to do
Awesome.
it again if anybody needs help. So
Yeah, thank you so much. And thank you all for coming. I'm going to stop recording now.